Welcome to Penn State Health Milton S. Hershey Medical Center, the flagship institution of Penn State Health, Central Pennsylvania's quaternary care academic medical center, and home to the Pennsylvania State University College of Medicine. Penn State Health is a multi-hospital health system serving patients and communities across 29 counties of Pennsylvania. Here at Hershey Medical Center, we have more than 70 ACGME accredited residency and fellowship programs. Our hometown, Hershey, Pennsylvania, offers an inclusive and welcoming environment toward people from all walks of life. While you're here, you are part of a community that is known for its natural beauty, plenty of green space, low cost of living, stress-free commuting, top-notch schools, comfortable and convenient shopping, and sweet history. The Department of Anesthesiology and Perioperative Medicine at Hershey Medical Center has a proud tradition of growth, education, research, and outstanding clinical care. Founded in 1970, our department has grown to boast more than 60 anesthesiologists, 60 certified registered nurse anesthetists, 68 residents, 8 fellows, 5 basic science researchers, and nearly 50 administrative support staff, all inspired together and committed to our institution's core values of respect, integrity, teamwork, and excellence. Welcome to our home. We are glad that you have chosen to consider becoming a part of our residency program. We are a family. We are Penn State. As we take you inside the inner workings of the day-to-day life here at Penn State, envision yourself as a resident in our innovative, integrated 4-year curriculum, one of the few 4-year programs in the country that integrates the clinical base rotations throughout the first 2 years of residency training. The program has selected rotations that will contribute to the experience and body of knowledge necessary to maximize your education in becoming superior consultants of anesthesiology.
I think one of the biggest surprises was how quickly you start to get autonomy and you start to get comfortable doing the job. Compared to a lot of other places I was looking, this place got you into the operating room doing anesthesia very quickly, which was appealing, but to realize just how much freedom and autonomy you got very quickly was a little surprising.
Over the first 12 months of your residency training, you will have the opportunity to spend approximately 5 to 6 months in the operating room, 1 month in our surgical anesthesia intensive care unit, approximately 1 month each in both acute and chronic pain services, as well as spending time as the junior perioperative resident. In addition to this time spent exclusively within the Department of Anesthesiology and Perioperative Medicine, you will also gain experiences in inpatient medicine, the medical intensive care unit, emergency medicine, and trauma surgery, as we are the only institution in the state of Pennsylvania with both adult and pediatric Level 1 trauma programs under one roof.
I think Penn State is unique in that during our first year we get several months, up to 6 months of anesthesiology experience, which is different than most other programs. A lot of other programs do that during their second year. So by the end of my first year, I was able to do cases by myself in the operating room. I was able to do a lot of procedures and feel comfortable doing those kinds of things. And that was something that a lot of other residents won't get to experience until their second year of anesthesia residency.
For example, a resident may have 1 month of pediatric pulmonology service with the following month in pediatric anesthesia. The month of floor specialties also allows for a smooth adjustment in terms of understanding preoperative and postoperative management of that specific patient population. Throughout the year, residents rotate through cardiac and thoracic anesthesia, ENT and pediatric anesthesia, neuroanesthesia, OB/GYN, surgical ICU, and PACU, and even have time for elective and research work. The early exposure to subspecialties can help residents recognize interests in other areas of the field in which they may want to pursue fellowship.
With the second year, you also do 6 months of off-service rotations, but then they're paired. So if you're doing cardiothoracic anesthesia, you're also doing a cardiac, like ICU month. And then if you're doing like neurosurgery, then you're gonna also have it paired with a neurosurgery ICU month. So things like that, it's paired so that it reinforces your learning here, and it's really great to grow as a resident when you have that continuity in care.
The third year of your residency training, also known as CA2 year, is divided into month-long rotations that continue to give residents exposure and practice within multiple subspecialties in anesthesiology. As senior residents, CA2 residents will begin to guide junior residents on the subspecialty rotations for the first time and start taking on more of a leadership role. In addition to the typical subspecialties in anesthesia, you will also have a dedicated rotation on vascular and transplant anesthesia. Penn State Health Milton S. Hershey Medical Center is a heart, liver, and kidney transplant center, and you will be integrally involved in taking care of the sickest patients from around the region.
You're looking at different residencies is you need to feel supported and you need to feel like a member of the department. And without a doubt, I know that I am supported by both the program directors as well as my other colleagues. I know that they'll assist us in any way possible, and they help shift some of the burden of residency off of us by always having things adequately prepared from a academic standpoint. They always make sure that we have our lectures lined up well in advance. There's never issues with scheduling and things like that. If you have a problem, you can undoubtedly take it to the administrative assistants, and they will help you find a solution quite easily.
The final year of your residency training, or CA3 year, is ultimately what each trainee makes of it. There are multiple months in which residents can choose their own flavor of anesthesia. Each resident can request complex cases and/or additional cardiac, pediatric, pain medicine, and ICU rotations. It is completely tailored to the trainee's interests. In addition, residents start to learn how to be an attending, and many residents start building confidence toward independent practice as team leader and teacher to the junior residents. Some unique rotations that are geared towards the senior trainee include an additional month of acute pain medicine, as well as ultrasound and TEE, and time at the outpatient surgery center on the medical center campus. In addition, you have the option to spend nearly 2 months practicing cardiac and/or obstetric anesthesia at a neighboring community hospital that is run by a private practice anesthesia group.
One of the things that's hard to get a feel for when you're applying to programs, this is even pre-COVID, even when you were able to come and interview, is how good the faculty are. And I have to say, I've worked with probably 95% of our faculty members, and there's not a weak link amongst them. I love working with all of them. They all have something to bring to the table. Every day you work in the OR with a new name next to yours, you learn something new, you learn a different way of approaching a problem.
Over your 4 years here at Penn State, it will become very apparent to you that you are part of something more than a residency training program. You will be mentored, respected, and supported by an outstanding group of individuals, and will become family from day one of your time with us. Longitudinally, over the 4 years, in addition to your clinical rotations, you will participate in simulation sessions, mock oral board exams, observe standardized clinical exams, and have the opportunity to participate in case conferences, journal club presentations, weekly didactic lectures and grand rounds, board review sessions, and even present at regional, national, and international academic conferences. Overall, the Department of Anesthesiology and Perioperative Medicine at Penn State Health, Milton S. Hershey Medical Center is a fantastic place to train, and residents move on to their respective jobs confident, skilled, knowledgeable, and prepared thanks to a breadth of experiences in and out of the operating room.